Hi, I'm Dr. Larry Anderson, Director of the Myeloma Program at UT Southwestern Medical Center in Dallas. And I had the pleasure of presenting the updated safety and efficacy results from the randomized phase 3 AURIGA study comparing Daratumumab and lenalidomide maintenance versus lenalidomide alone as maintenance for newly diagnosed myeloma patients after stem cell transplant. As I mentioned, the AURIGA study evaluated the combination of Daratumumab and lenalidomide compared with lenalidomide alone. Currently, the standard of care, or at least historically the standard of care for maintenance therapy in newly diagnosed myeloma after stem cell transplant has been lenalidomide alone. That has been challenged by more recent studies, including this AURIGA study that has added Daratumumab to the lenalidomide. So maintenance therapy is when we continue the patient on some form of therapy after their induction therapy and their stem cell transplant, and we continue them on that and either for a defined period of time or until relapse. And so most patients in the US anyway are on lenalidomide either indefinitely or until some people would consider stopping it after sustained MRD negativity. MRD is a test that we use for these studies to evaluate the outcomes. MRD stands for minimal residual disease, or some say measurable residual disease. It's done by a molecular test on the bone marrow to look for as few as 1 out of 100,000, or in some cases 1 out of 1,000,000 bone marrow cells can be detected with this molecular assay. And so if patients have no detectable disease by MRD, that's considered a very deep molecular remission. And so that's a very favorable outcome. And so this study, called the AURIGA study, compared these two different forms of maintenance therapy with either Daratumumab and lenalidomide versus lenalidomide alone in patients who were still MRD positive after their stem cell transplant. And in this study, the patients were limited to patients who had not received anti-CD38 therapy. Daratumumab is an anti-CD38 monoclonal antibody. And so in this study, those patients had not received Daratumumab before their maintenance therapy. They were MRD positive, and they had achieved at least a very good partial remission after their stem cell transplant. So they weren't the patients that were growing through everything. So they were randomized 1-to-1 to receive one or the other of these two therapies, and they were to receive it for up to 36 months, or 36 cycles of therapy. The preliminary or primary analysis has already been reported at the 12-month time point. The MRD testing was done at 12 months, 18 months, 24 months, and 36 months. So the previous results from the 12-month time point already showed more than doubling of the MRD negative conversion rate. So that means the patients turned from MRD positive to MRD negative by 12 months. The rates were more than doubled in the Dara plus lenalidomide group compared to lenalidomide alone. In this study, overall 40.3 months of median follow-up for these patients. And at this time point, we are still seeing more than doubling of the MRD negative conversion rates. Both of those sensitivities, the 10 to the minus fifth, which is less than 1 in 100,000 cells, and the 10 to the minus 6, which is less than 1 in 1,000,000 bone marrow cells, across all key subgroups. So regardless of race, stage, age, cytogenetics as well. And one of the other things that we really look for with MRD testing is sustained MRD negativity. So not just at one time point, but we want to see it lasting, staying in molecular remission. So we also looked at sustained, or 6-month sustained and 12-month sustained MRD negativity rates, and they were more than doubled at the 10 to the minus fifth threshold and quadrupled at the 10 to the minus sixth threshold by adding Daratumumab to their lenalidomide. There was no increased safety risk, so there was no increase in high-grade toxicities or infections, and there was no increased risk of discontinuing study therapy in the group that got the double therapy. If anything, they, on average, stayed on therapy longer, and more of them were able to keep on therapy because their remissions lasted longer, and they did better, and they were able to stay on that therapy longer. There was a increased progression-free survival. That means more patients were alive and progression-free at at the 36-month time point. And there was a trend toward a favorable improvement in overall survival, which is not statistically significant yet, but we need further follow-up to determine if that's going to continue to pan out. But overall, this updated safety and efficacy report from the Araga study shows ongoing improved efficacy with the combination of Daratumumab lenalidomide versus lenalidomide alone in patients who were MRD positive after their stem cell transplant.